Hello, my name is Andy Subika. I'm an associate professor at the University of California, Riverside School of Medicine, and I'm presenting my video abstract for the AJPH publication, CRISPR in Public Health, the Health Equity Implications and Role of Community in Gene Editing Research and Applications. For this video abstract, I'll be addressing four main research questions. What is CRISPR? What are the clinical and public health implications of CRISPR? How could CRISPR affect health equity? And how can we promote health equity in CRISPR? So CRISPR is an innovative Nobel Prize-winning technology that allows scientists to precisely target, regulate, edit, and modify the human genome. As a result, CRISPR has major potential to enhance the medical sciences and also public health. However, it is unlikely that CRISPR will benefit those with the greatest health needs in society without adequate community inclusion and participation. What is CRISPR? CRISPR is a technology that repurposes bacteria's CRISPR immune system against viruses to modify, insert, or delete DNA sequences. Really, what CRISPR does is in bacteria, the CRISPR immune system identifies viruses that invade the bacterial cell and deploy Cas CRISPR-associated scissors enzymes that can find and cut the virus to disable it. And it's able to do this with the help of implanted RNA-based guides that are specifically tuned to the virus genetic signature. In the laboratory, scientists can now precisely edit any DNA sequence in animal, bacterial, viral, or human genome by inserting lab-designed RNA-based guides into these CRISPR-Cas complexes. And the benefit of CRISPR is more precise and time-efficient and cost-efficient than previous gene editing technologies that were more labor-intensive, more expensive, and had more potential for errors such as off-target effects. There are two main clinical benefits to CRISPR technology. The first, it is already improving the study of human diseases by leading to identification of key genetic pathways for diseases because it allows scientists to more rapidly gene edit as well as study human diseases such as cancer using animal models in the lab. A second benefit is that CRISPR can allow scientists to create more effective gene therapies to potentially cure hereditary diseases such as sickle cell anemia. In fact, the CRISPR therapy exa-cel is already currently under FDA review for approval. There are clear clinical benefits involved with CRISPR that are well established at this point. However, the public health benefits of CRISPR are murkier, although there are still significant potential public health benefits involved with this technology. First, CRISPR may help to improve virus surveillance in communities for infectious diseases, as CRISPR-based assays such as Cas13 can allow health professionals in the future to cheaply diagnose hundreds of viruses per sample, which can facilitate rapid public health responses to outbreaks. Also, it can allow for the reduced infectious disease transmission from vectors or living organisms, which are responsible for about 17% of infectious diseases worldwide and account for over 700,000 deaths annually globally. And in the laboratory, CRISPR gene drives have already shown proof of concept in being able to block mosquitoes from transmitting the malarial virus. And third, although this is decades potentially in the future, CRISPR may help to address food insecurity through CRISPR-modified agriculture, such as through the development of pest-resistant and climate-resistant fruits and vegetables, higher yield grains and legumes such as wheat and soy, and disease-resistant and more ethically farmed livestock such as horned cattle. Although there are many clinical and public health potential benefits around CRISPR, one thing I did want to highlight are there are several public health concerns and health equity concerns. For instance, from a public health perspective, most leading causes of morbidity and mortality have multiple causal factors that extend beyond genetics. These include environmental factors and social factors, and this is especially true for addressing health disparities, which are undergirded by social factors such as social determinants of health. Also, CRISPR therapies are limited to being able to treat individual patients as opposed to populations. And thus, CRISPR therapies will create health improvements in only one patient at a time, making it difficult to scale to a population level. From a health equity perspective, one issue surrounds fundamental cause theory, which states that across medical history, major scientific breakthroughs have overwhelmingly benefited advantaged versus disadvantaged groups. And thus, major breakthroughs such as CRISPR may actually worsen rather than improve health equity. This is apparent in the fact that CRISPR is likely to have extreme costs, which may lead to disparities in healthcare access and benefits. For instance, the exocell therapy is expected to potentially exceed $4 million per one-time treatment. And research has shown that extreme medication pricing can lead to discrepant healthcare access, especially for underrepresented groups. When CRISPR hits the marketplace, CRISPR therapies are unlikely to be available to individuals without healthcare access or those who live in areas that have limited healthcare. And this may reflect the effects of social inequities such as structural racism, residential segregation. Also, minorities are highly underrepresented in genomics research. And this is problematic because different groups have genetic differences, yet most participants in genomics research are from European ancestry. Thus, if this is the case with CRISPR research, therapies that are developed may prove less effective or may not generalize appropriately to culturally diverse patients. So how do we address these health equity concerns? Well, first is that the use of CRISPR should be grounded in principles of fairness, justice, and access to ensure that CRISPR enhances rather than impairs health equity. We must increase the inclusion of underrepresented groups, but really all groups in every phase of the CRISPR research process to avoid worsening health inequities, as well as mistrust. And community-based participant research or CBPR may be optimal for promoting equity in CRISPR. How can CBPR play a role in this? Well, CBPR is a process that involves community partners in all research stages, from conceptualization to conducting the research, interpretation of results, and the implementation dissemination. And through this process, we can better ensure that communities will more equitably benefit from their participation in CRISPR research. Also, conducting CBPR can cultivate trust and acceptance, especially with underrepresented groups. And it can do this by promoting transparency about benefits, risks, and costs associated with CRISPR, CRISPR therapies, CRISPR technology, as well as assist in developing culture responsive messaging and communication. And finally, CBPR can help scientists design studies and interventions that have improved ecological validity. Therapies designed through a CRISPR process are logically more likely to be feasible, community accepted, used, and then potentially effective versus CRISPR interventions that are designed without any input or decision-making from communities that they are affecting. And this is important because currently right now, we have an early window to intervene before CRISPR research methods, studies, as well as clinical and public health practices involving CRISPR become locked in and hard to change. Here are the references, and invite you to read the full article at the link below on the AJPH website. Thank you.